Hi, my name is Dr. Eisenmann,
Hi, I'm Kat Little.
and I am one of the providers, and she is the medical assistant and resident vampire here at Resiliency Brain Health. So that you guys know that we do more than just non-invasive therapies. We actually look at blood work, and we like to interpret blood work when it comes to traumatic brain injuries. There's another person we need to introduce here. So what did we decide his name was?
I think we decided we were going to call him General Mustache or Mustachio.
Yeah, Mustachio, General Mustachio. So the reason we have this little guy here today is because we are going to be talking about probably our favorite topic, which is veteran brain health. And so today is going to be a whole discussion about, what sets us apart in the veteran community. What are some kind of therapies, treatments that we offer, and why is it different than traditional? And then some kind of deeper conversations that we've had with some of our previous patients, letting you guys know this is a open and safe space for you guys to talk.
Yeah.
But number one, what is your favorite thing about working with veterans?
I mean, it's always,
As a veteran yourself.
we're pretty funny people.
Yes.
We are pretty funny people on a general basis. And medicine in itself can be very hard and heavy. Here it can be heavy. So I like the funny part of it. That's my favorite part here, is just being able to bring that levity.
Yeah, and I think this, I feel like sounds like a cliche, but there's many reasons I love working with veterans. One of them is to feel like I can give back to you guys in a way that I know I never will. I mean, the courage that it takes to go to the military, even if you didn't do it for that reason, even if you were trying to get away from home or something, the fact that you did go there, it's like my only way to be able to say thank you. But also, I have a grandpa that was a Korean War veteran, and I have his flag in my exam room, which is a fun talking point when people come in and see that and just ask, like, whose
is that?
Yeah.
It's not yours.
No, definitely not. Definitely not. He was incredibly courageous, and he did not have access
to any of the health.
No.
I know, it's crazy.
Yeah.
And you guys know I'm a veteran myself, and finding a safe place to talk about some of the things that you experience in your time in service is very, very hard. Not just that, but it doesn't. Sometimes we take a very humorous approach to some very serious things. And that is very hard for some people to deal with and navigate. Ends up in situations where we may be deemed not as mentally stable as we should be. And that's not really fair, just because we know how to look at humor because of the situations that we've been exposed to. We appreciate the small chances of humor.
Yeah.
But when we have the serious things to talk about, it is really hard to find somewhere to go where you feel comfortable, where you don't feel like you're going to be given a new diagnosis or a new drug, or have to navigate life for 2 more weeks in that state.
Yeah. So for some of you that don't know what our clinic does, which is called functional neurology, functional medicine. We're in the functional sphere, if you want to call it. I mean, if you want to give it a label of some sort, I call it healthcare.
I call it healthcare
Yeah.
because it should.
Because it should be.
We should be normal.
Yes, and so one of the things that we strive in here is to provide more non-invasive treatments and non-invasive therapy options, non-invasive ways to be able to look at functional patterns of things. And so we focus on quite literally your brain's level of function. And we assess through a neurodevelopmental, or like brain from baby to adult, how your brain is functioning after injury. And so that's something that's not very well addressed in the military, especially after struggling with a traumatic brain injury, which, let's just clarify, if you have ever had a rollover vehicle accident.
A hard landing.
A hard landing if you have ever been exposed to blast injuries, like, or blast exposures, if you've ever had, how many rounds with mortars,
Yeah,
like,
mortar rounds.
yeah,
Talk about Carl Gustavs.
artillery,
You,
gunners.
all the things go into account. Our brain is made of jelly. If you shake our head hard enough, it's going to jiggle a little.
Yep, it's going to jiggle a little. And the consistency of the brain versus the brain stem, very different. I like to say that the brain stem feels like a celery stalk.
Okay.
And then the brain itself feels like jelly. And so these different mediums going through that level of blast exposure causes something called a shearing effect, which can then scramble
The signals.
the signals.
Yeah.
That's a great way to talk about it. The signals. And so we don't just stick at the point of doing some assessments, right? We take it a step further. We go really deep into hour-long histories, examinations,
And not mention the blood work, too.
blood work too.
my
So
job.
I would say, I mean, if you really had to compile together how many hours it takes for us to do everything start to finish,
Okay.
but we do it seamlessly, so you don't feel like you're here for that long.
I would say that from start to finish, even with review of history prior to coming in, and the plan of action for once we do get them in the first day and actually touch them, put hands on them, we spend at least 4 to 6 hours navigating how to get that patient in this clinic to best serve them, because it is not a cookie cutter treatment plan. Because let's be real, none of us are sweet enough to be cookies.
Yeah, yeah, and she's totally right. And one of the things that we want to strive for is to we're not trying to replace your medical doctor.
No.
We're not medical doctors. We are doctors of chiropractic that have functional neurology behind us, and we have additional licensures that allow us to look at things through a functional perspective. But where I'd like to think that this really fits the bill is we want to take you away from aggressive intervention and needing that, and separating out the people that are a horse versus a zebra. So people that need aggressive care and intervention can actually have better accessibility to it, and people that are struggling with things that can be modified through lifestyle and non-invasive treatments can actually benefit from them and pivot to actually lifestyle management.
Yeah, wellness rather than treatment per se.
Yeah.
Is I think where we would go. Yes, it is a treatment protocol, but it is not a new medication or a new prescription. Pending working, you
Yeah.
know, being able to transition into actual wellness care versus a treatment protocol,
Which feels great,
Yeah.
because if you've been a patient that's been going doctor to doctor to doctor, going somewhere that then gives you tools to manage yourself
and
teaches
explains to you how to use them, because
Yeah.
I say that a lot in here, like knowing why you do something changes how you approach doing it, truly, in regards to eye exercises, homework, all of those things. If you know why you are doing it, most of our veterans are going to ask us why.
Why?
Why? Here's why. Because it works.
Yeah. And so that's one of the many things. And as you can see, we're laughing a lot because you kind of have to laugh through it. Sometimes the brain does some funny things that you're like, I didn't mean to say that or move that way. But it is completely non-invasive, and we do partner, and we want to educate furthermore and look into potential autoimmunity and other things that may be happening. I think another unique perspective of us and what sets us apart from regular clinics, and not just regular clinics, but why people need to understand that as a veteran, you're better off going to places that have seen veterans before, is because y'all don't come in with just a concussion. And so we have to look at you as a whole individual. Dental health, your prior dental history, your prior, if you have gunshot wounds, if you've had, a fused vertebrae, if you...
We also take into account all of our veterans, even before all of the recent changes in healthcare and vaccination requirements for the healthcare, we've been exposed to virus levels through vaccinations for deployment that are absolutely unnecessary for the majority of the population. And those viral loads, they go into our body and they don't just go in there and chill quietly.
Yeah. Yeah. And so that means that we're looking at you guys as a whole individual.
Not just pieces of you.
Yeah.
It's not, we're building the puzzle.
Yeah.
Y'all are bringing us the pieces.
And we're not the end all be all. We often make recommendations and we refer people out to different things. But what we like to do is we like to take you, welcome you home, and really help you look at everything that has been separated from you for different sides of healthcare and paint the picture as to how does it all go together and what is your next step after you've been able to heal parts of concussion and help the brain understand how to sensory integrate better again.
Now that I have clarity to be able to decide, that's
Decision
the next
making
thing.
is
Decision
a
making
big deal.
before even going through the treatment, they may not even be able to navigate that. I wasn't necessarily able to navigate that before I got through the treatment protocol.
Yeah. And then you put a very good point earlier too, is that there are serious
There's
conversations.
super serious conversations. I know that I've had them with you, and some of them even shocked you.
Yeah. Very, very serious conversations in here. And that's not to say that we're going to replace counseling or psychology or anything in that sense, but true healing happens when you feel comfortable enough to tell someone, hey, I struggled with potential suicide ideation. And that is something that happens a lot. And so our message to you, if you're a veteran that has been struggling with, you know, going doctor to doctor, not really being treated for your traumatic brain injury. The only thing that's been done for your traumatic brain injury is cognitive work alone.
Or even just prescriptions that have
just
side effects.
Prescription only treatment plans that don't take into account function, community, nutrition, sleep habits. Our message to you is that we've had... This is a safe place, and we've had people before, many people sit in this couch and do testimonials about how they were once in a very dark place and they had had multiple suicide attempts. But what they learned is that their brain was on fire.
It was doing it without them, without their permission, literally.
Without it. And so once they were able to kind of calm the fire, and they have specifically said to us, now I know that this is what I needed. This is what I needed to shift the narrative. This is what I needed to move forward. And so I think that kind of wraps up this whole conversation. You know, you didn't really give anything to us in this conversation. But is there anything else you want to add before we are done?
We laugh a lot because we deal with a lot of serious stuff. You're not alone. We're not in this by ourselves. You have people that are standing at your back. We've got your back. You can call us whenever you are in those bad situations. We will help you.
Our admin team is fantastic at being able to just talk to you and get you plugged into the clinic, and get you started with, where do I even begin? Because it can be super overwhelming.
We also have our circle, which puts them in the same program as other veterans that have been through here that might
we have a
run into
platform.
that.
We have a platform that's only for veterans and first responders that have been through the clinic, so that there is a community build relationship of, hey, I've had this happen and now I'm here, and how do I continue to move forward? So if you want more information about us, please look us up at resilienceybh.com, and don't be a stranger, and just know that not another person doesn't need this more than you. There's not another veteran that needs to be here in your place. You need to actually come in and get better, because if you get better, you help people get better.
It's true. It's true.